Welcome back to Prepper's Paradigm, your go-to guide for all things prepping. Today, we're tackling a critical aspect of bugging in, preparing your medical equipment and first aid skills for bugging in. When disaster strikes and you're hunkered down, access to medical professionals may be limited. That's why having a well-stocked first aid kit and the know-how to use it is essential. We'll guide you through creating an emergency medical game plan that fits with your bugging strategy, ensuring you're prepared for anything from minor scrapes to major medical events. Before we start, if you enjoy our content, please don't forget to hit that like button and subscribe for more straightforward prepping advice. Let's start with the cornerstone of medical preparedness, assembling a comprehensive first aid kit. Your kit should be tailored to your and your family's specific needs, taking into account any unique medical conditions. Here's a checklist of items to include in your first aid kit to ensure you're well prepared for any situation. This list covers the basics for first aid needs at home, whether during normal day-to-day life or for bugging in after a major disaster. Bleeding control. To stop severe bleeding for a major injury on an arm or leg, include a tourniquet in your first aid kit. This will completely stop the blood flow to the limb. Additionally, add some emergency bandages, also known as Israeli bandages. These are very useful for quickly controlling heavy bleeding and can be used almost anywhere on the body. Bandages and dressings. Your first aid kit should contain various sizes of band-aids, bandages, sterile gauze pads, and adhesive tape for dressing wounds, and some elastic bandages for sprains and strains. Tools and equipment include medical gloves for hygiene, scissors, tweezers, a digital thermometer, and a flashlight with extra batteries. Antiseptics and cleaners. Your kit should have a selection of antiseptics and cleaners, such as antibiotic ointment, antiseptic wipes or spray, hydrogen peroxide, and alcohol pads for disinfection. Medications. Add pain relievers to your kit, such as acetaminophen, ibuprofen, aspirin, antihistamines for allergic reactions, and any prescription medications that are regularly needed. Ensure you follow the instructions when taking any medications. Specialty items. To further increase the usefulness of your first aid kit, add burn gel or burn treatment pads, hydrocortisone cream for rashes and itching, rehydration salts, and aloe vera for burns. Miscellaneous supplies. Also useful to include are items such as a CPR face shield, emergency blanket, and instant cold packs. Personal items. Consider adding a supply of personal medications, an epinephrine auto-injector, sometimes referred to as an EpiPen, if there's an severe allergy, and any other personal items that are specifically needed. It's also wise to include a notepad and pen for documenting the nature of the injury and care provided, and a list of emergency contact numbers, including poison control. There's a link in the video description below to list on Amazon of items you need for your first aid kit. In addition to your first aid kit, one more invaluable resource I highly recommend is the book Where There Is No Doctor by David Werner. Renowned as perhaps the most widely used off-grid healthcare manual in the world, this book is incredibly important for preppers for several reasons. Firstly, Where There Is No Doctor is written in clear, accessible language, making it easy to understand for those without medical training. It covers a broad range of topics, from preventive care and hygiene to diagnosing and treating common illnesses and injuries. This makes it an essential guide for those bugging in, especially in scenarios where professional medical help may not be immediately available. Moreover, the book emphasizes low-cost, simple techniques that can be life-saving in emergency situations. It encourages a community-based approach to healthcare, aligning perfectly with the prepping philosophy of self-reliance and mutual aid. Where There Is No Doctor is more than just adding a book to your shelf. It's about empowering yourself with knowledge that could be crucial in a post-disaster world. We strongly encourage all preppers to purchase a copy and make it a centerpiece of their medical preparedness efforts. I've added a link to the book on Amazon in the video description. While we've discussed assembling a comprehensive first aid kit and the essentials it should contain, it's important to address the realities of what non-medically trained individuals can truly manage in a post-disaster scenario, particularly when bugging in. Treating minor injuries, such as cuts, burns, or sprains, is within the realm of possibility for most prepared individuals. Your first aid kit and the knowledge you've gained can significantly mitigate these situations. However, it's crucial to understand that major injuries or conditions requiring surgical intervention present a challenge far beyond the scope of first aid. Despite the best prepared kit, some situations necessitate professional medical assistance, which might not be immediately accessible post-disaster. This reality underlines the importance of community preparedness. In times of crisis, having a network of people with varying skills, including medical professionals, can make a significant difference. It also highlights why learning basic first aid and CPR is just the beginning. Ongoing education, realistic planning, and community engagement are key to truly being prepared. In the end, preparedness is about doing the best we can with what we have. It's about recognizing our limitations and planning accordingly. Remember, the strength of a community often lies in its preparedness to support its members through the toughest times. Now that we've covered the essentials for assembling your first aid kit, let's dive into understanding a few basic first aid procedures. Knowledge is just as crucial as having the right tools. And so, first aid training and a good book such as Where There Is No Doctor are just as important as having a good first aid kit. In the meantime, here are a few tips. For sprains and strains, remember the RICE method: rest, ice, compression, and elevation. This simple procedure can significantly reduce recovery time and prevent further injury. When it comes to minor cuts and scrapes, cleaning the wound with soap and clean water is key, followed by applying a sterile bandage to protect the wound if necessary. Avoid using cotton directly on wounds as it can stick, and remember to change the dressing regularly to prevent infection. For more major injuries with significant bleeding, stopping the bleeding is the #1 priority. Apply pressure to the area using a clean gauze pad, or if necessary, apply a tourniquet or Israeli bandage and seek assistance of medical professionals. If someone is not breathing, knowing how to perform CPR can be life-saving. Chest compressions, combined with rescue breaths, may be able to resuscitate the casualty, or may sustain their life until professional help arrives. These are just a few of the basic first aid procedures that you should learn. Understanding and applying them can make a significant difference in a bug-in scenario. We encourage everyone to take a certified first aid course to further enhance your skills and confidence in handling common injuries, as well as adding the book Where There Is No Doctor to your collection. While basic first aid covers a wide array of common injuries, some situations escalate into emergent medical issues that require quick and decisive action. Understanding how to respond can be the difference between life and death. Allergic reactions can range from mild to life-threatening. In the case of severe reactions, known as anaphylaxis, administering an epinephrine auto-injector immediately is crucial, followed by seeking emergency medical help. Asthma attacks require prompt action. Ensure easy access to rescue inhalers, and remain calm while assisting the individual in taking their medication. Knowing the signs of a severe attack is vital for when emergency services are needed. Choking is a frightening event where immediate response is necessary. Techniques like back blows and abdominal thrusts can save a life before professional help arrives. In cases of cardiac arrest, CPR becomes a life-saving skill. If you're not trained, now is the time to learn. CPR can double or even triple a person's chance of survival until emergency responders arrive. Understanding how to handle emergent medical issues complements your first aid knowledge, preparing you to act confidently in critical moments. Remember, professional medical help is the best way to deal with major medical events, so if possible, find professional medical help as soon as possible. After SHTF, this will be impossible unless you happen to have medical professionals in your group and very good medical kit and care facilities. However, an experienced and trained first aider can still provide good care and a better chance of survival than people who have no first aid knowledge. Bugging in requires more than just preparing for acute medical emergencies. It also means managing chronic conditions with limited access to healthcare services. Let's talk about how to maintain health and wellness for those with ongoing medical needs. First, ensure you have an ample supply of all necessary medications. This might mean requesting larger supplies from your healthcare provider or exploring mail-order options to secure a stockpile for several months. Self-monitoring is crucial. For conditions like diabetes or hypertension, keep a close eye on your health indicators. Devices such as blood glucose meters and blood pressure monitors are invaluable tools for staying ahead of potential complications. Maintain an updated list of contacts for healthcare providers, pharmacies, and local support groups. In times of need, knowing whom to call for advice or prescription refills can make a significant difference. Leverage technology. Many health applications and online resources offer guidance and support for managing chronic conditions. They can provide reminders for medication, track health data, and even connect you with professionals for telehealth consultations. Managing chronic conditions during a bug-in scenario is about preparation, routine, and adapting to new challenges. By taking proactive steps, you can ensure that you or your loved ones continue to thrive, regardless of the circumstances outside. Beyond physical health and safety, maintaining mental health and morale is crucial during extended periods of bugging in. Let's explore how to nurture mental well-being and keep spirits high, even in challenging times. Whatever the scenario, when you are bugging in, you will be able to do at least some, if not all of the following. Firstly, establish routines that include leisure and fun. Engaging in things that you enjoy, even if it's something as simple as playing board games or reading, can provide much-needed breaks from stress. These activities not only entertain but also strengthen bonds and create a sense of normalcy. Incorporate mindfulness and physical exercise into your daily routine. Practices like meditation, yoga, or even simple stretching exercises can significantly reduce anxiety and improve mood. Stay connected with loved ones. If you have power and communication networks available, use technology for video calls, virtual game nights, or sharing updates. Social connections are vital for emotional support and combating feelings of isolation. Remember, taking care of your mental health is as important as physical health. By fostering a supportive environment and engaging in positive activities, we can navigate the challenges of bugging in with resilience and optimism. As we've navigated through the essentials of bugging in, from first aid preparedness to mental health, the foundation of all these efforts is knowledge and training. Let's discuss the importance of further education and where to find valuable resources. First and foremost, obtaining a certification in first aid and CPR can be invaluable. These certifications provide not only the skills to save lives, but also the confidence to act when it matters most. In today's digital age, a wealth of knowledge is at our fingertips. Online platforms offer courses on survival skills, emergency preparedness, and managing health conditions. Engaging in these can dramatically enhance your readiness. Don't underestimate the power of community. Local workshops and group meetings can offer hands-on experience and the opportunity to share knowledge and skills. Building a network of prepared individuals enhances collective resilience. Remember, the journey of preparedness is ongoing. By dedicating time to training and resource gathering, you're not just preparing to survive, you're preparing to thrive. Start today and step by step, build your knowledge and skills for whatever the future holds. Thank you for watching. If you enjoy our content, don't forget to subscribe for more. Until next time, this is Preppers Paradigm signing off.